So biosafety level 2 labs require that you wear personal protective equipment. The main equipment that's required for labs, you'll be required in this lab to bring your own lab coat to the lab classes. The other equipment we'll provide, the main thing you'll use are the gloves. And eye protection is standard part of PPE if aerosols are going to be created and you might get hazardous materials in your eyes. However, we want to keep things safe for COVID and contaminate as few things as possible. So we're going to make sure that we do the labs in a way that eye protection will not be required, that we're not going to create aerosols. So eye protection is sometimes used, but in this lab, we're going to do things so that you don't need it. Every time you're done using equipment, you'll need to clean your area. So if it's tabletops, treadmills, equipment, you're basically just going to use a disinfectant spray and give it a good wipe. Ideally, the surface that you're cleaning will be wet, visually wet, for at least a minute. If you use treadmills, you touch the rails, you touch the control boards, whatever you touch, you want to make sure, so you're working as teams in this lab, make sure you're cleaning things off, do a good job, keep things safe for everyone, do a nice wipe. It's a good idea to do it before and after, so you know you're starting with clean. You don't have to trust the people in front of you, and then you finish by making sure it's safe for the people that come after you. The one exception is if you're using computers in this lab, we don't want to use sprays on the keyboards or the mice. Instead, you want to use an isopropyl alcohol pad. That'll keep the keyboard from getting wet. The alcohol evaporates. So just do a good little wipe of the keys. And then the mouse. Now, when you're doing your cleanups up in your biohazard space, you keep your PPE on. When you're all done, you can throw disinfectant wipes, paper towels, and alcohol wipes just in regular trash, because the disinfectant will take care of that. You won't need to worry about that. If you're done, there are a couple of things that you do. First of all, your lab coat should never be worn anywhere but in the lab. So if you take that off, if you're going to go to the restroom, you're going to go outside the lab, you take it off. You leave it in here. If you're done, then take your lab coat off and put it away. Now, there's a particular way in the lab report, the lab manual, that describes how to get rid of, take off gloves. It's fairly simple. You just peel one glove off, put it in the palm of the other hand, scrunch it up, peel the other glove off so it ends up inside out with the other glove in it. And these gloves go in red bag biohazard trash, not in the regular trash. Your lab GTAs will help you make sure you know where to throw things. It's important to make sure that you dispose of everything in this lab in the correct place. So there's 3 types of waste streams, 3 types of trash. Anything that's sharp, and when you're doing labs that involve sharps, the GTAs were very clear where they should go. Lancets, for example, for finger sticks, go in hard-sided sharps container. Make sure those containers are never more than 3/4 full. Never reach into those containers. Just toss the sharp thing in and be done. Other biohazardous waste that's not sharps, for example, your gloves, gauze wipes that might have blood on them, they go in what we call red bag trash or biohazard trash that goes into a soft bag, no sharps go in there. Everything else, so the paper towels, things that you use to wipe your spaces, can just go in regular garbage. So again, sharps in the sharp containers, biohazardous contaminated waste in the red bag waste, and then things that are not biohazardous, not contaminated, can just go in the regular trash.